Ms. Gay, are there fraud, waste, and abuse risks in state Medicaid programs when providers are allowed to self-attest to becoming enrolled?
I do believe. I will say most of my experience is not working directly with the states, but with managed care organizations and Medicare Advantage plans. But I do think that there needs to be additional oversight in our self-reporting across the board for eligibility, both for provider participation as well as member eligibility.
Do you think that there's increased risk of fraud in state Medicaid programs that provide services that are billed hourly, such as personal care services or adult daycare?
Absolutely.
New York's consumer-directed personal assistant program is under scrutiny due in large part to the increases in spending and the lack of provider oversight. In CDPAP, individuals hire their own caregivers, including immediate family members that are paid through a fiscal intermediary to provide assistance with daily living activities. In one case, a man signed up to be a personal caregiver for 10 relatives. To get away with this scheme, this man's brother posed as their mother, a recipient of Medicaid home care services herself and other welfare benefits. However, there's a little detail that was missed. She lives in Bangladesh, and she lived in Bangladesh for the entire time. This man was eventually caught and convicted for his crimes. Ms. Gay, are you aware of other state Medicaid programs or similar program designed to CDPAP for personal or home care services?
Yes.
What are the issues that you have identified with how this program and the category with that structuring has opened the door to so much overt fraud?
I think one of the things that we see that might be helpful, so oftentimes these personal care services are being rendered by somebody that doesn't have an MPI. An MPI is your national provider ID that you are supposed to use to bill. If I am setting up care for my mother, I don't have one of those IDs, and that billing goes under a TIN for an organization that I might be working with. So there's a discrepancy or a challenge, I guess, in how we look at that claims file data, and there's also disparate data sources. So if I am working through one MCO for one member and another MCO for another member, they can't see that I'm rendering services to multiple members, nor can they potentially see that it's me individually rendering those services at all. So there really is some data issues. I think our system was initially more designed for providers and practitioners that were billing services. And now that we're extending those services with good intention, we're creating other limitations in our ability to fight back.